Guys, woman to woman, have you ever peed yourself a little bit when you jump up and down? Or have you ever lost control of your bladder when you're laughing so hard with your girlfriends at brunch? Well, I'm here to tell you that that is not normal and it is actually signs of a pelvic floor issue. I'm also here to tell you that whether or not you've had a child, it does not matter. You can still have pelvic floor issues and you can still pee when you laugh or pee when you jump up and down. And no matter what your history is, we can help you fix that. I'm Dr. Christina, a doctor of physical therapy of 12 years. I'm also an orthopedic certified specialist and co-own a physical therapy practice in Southeast Houston. On top of that, I'm a mom. I've had 2 children myself, and so I've been on my own pelvic floor journey, which inspired me to help other women who do not know yet that peeing yourself when you laugh, jump, sneeze is not normal, and we should not be accepting that as our new life norm. Today, I'm excited to share with you 5 exercises that you can do to help with this issue, and I'm going to explain to you how exactly these exercises help your pelvic floor. For our first exercise we're going to go over is a pelvic tilt. Now, I know you've probably seen pelvic tilts before. You've done them in Pilates class, you've done them in yoga class, you've been told to do them by your friend who had pelvic floor issues, but I want to go over with you today how to do them correctly, because they're a very easy exercise to do, but that also means they're very easy to get wrong, and you could sometimes be doing more damage than not if you are not doing them correctly. So let's talk about it. When you're doing a pelvic tilt, you're going to start on your back on the floor with your knees bent and feet flat. Now, you can do a pelvic tilt seated, standing, and it's very helpful to learn how to do a pelvic tilt in those positions as well, but we're going to start with the basics today. So on your back for that pelvic tilt, the first thing you're going to do is you're going to draw your belly button in towards your spine like you're trying to get real skinny, all right? And then you're going to imagine doing a reverse crunch, okay? So a regular crunch would be you're laying on the ground and you bring your chest down towards your belly button as you lift your back up off the ground, right? So a reverse crunch is going to be you're going to pull your pubic bone up towards your belly button by using your lower abdominal muscles. Bet you didn't know that you had abdominal muscles down there, but you do, and they're very important. Very specifically, we're trying to work on your transverse abdominis muscle. And so when you're doing the pelvic tilts, the compensations that you're going to watch out for is you are not going to push through your feet while you're doing this. You're not going to squeeze your bottom in order to achieve this. When you do a pelvic tilt, you're also going to make sure that your knees are staying in line with your hips and not flaring out as you do it. It may seem counterintuitive, but it actually makes it easier for you to do that pelvic tilt when your knees are in line, because your adductors are part of your pelvic floor and can assist you in engaging your transverse abdominis. This exercise is super important for learning how to control the intra-abdominal pressure in your organ cavity. It's important for learning how to lengthen your spine for any back pain issues you might be having. And it's important because this is not only an exercise, this is a position and contraction that you should be doing during any core exercise ever in the future. I don't care if you're standing, if you're laying down, if you're on your side, if you're on all fours, if you're hanging from the ceiling and doing leg raise crunches, you should be in a pelvic tilt. Our second exercise that we're going to go over that is helpful for pelvic floor issues is back breathing. One of the reasons that many women have issues with peeing themselves when they jump, when they laugh, when they sneeze, whether or not you've had children, is because we don't understand how to control the intra-abdominal pressure in our bodies, all right? When I ask a lot of people how they contract their core, what I'll notice is that they do bracing instead of what we call contracting your transverse abdominis. So what's bracing? Bracing is when if you squeeze your core, if I told you to squeeze your core right now and you feel your belly pop out rather than pull in, you are bracing, okay? And that actually builds intra-abdominal pressure in your body cavity. So what we need to learn to do is how to keep your core engaged while still being able to breathe and expand your lungs in order to evenly distribute the pressure in your abdominal cavity and not just have all of it pressing straight down into your pelvic floor, causing you to lose control and pee yourself. Back breathing is going to be achieved today, it can be achieved in many positions. But today we're going to practice it in child's pose because that's one of the easiest ones to learn how to do it. So in child's pose, you can do this with a pillow underneath your stomach or without, depending on your comfort level. And you're going to reach your arms forward just like a regular child's pose stretch. Sit your bottom back, but you're going to combine a pelvic tilt with this exercise. Instead of having your back flat as you reach back and do your child's pose, you're gonna have a nice rounded spine. So you're really stretching out all those muscles, okay? And when you do that, it creates space for you to back breathe. Now, what is this back breathing? Physiologically, like what am I mean when I say back breathing? What I noticed for a lot of folks, and I can speak to this myself because I have a medical history of asthma. So if you're an asthmatic, you've probably experienced before tension that builds in your neck muscles, in your chest whenever you feel like you can't breathe. And most of us tend to breathe in an upwards and forwards direction as we take a breath in, like okay? So right now you can even take a breath and see, how do I normally breathe? What part of my body moves whenever I take a breath in? Did you know that you should actually be able to breathe in a 360 direction? Meaning, we should be able to breathe in a forward direction, a backwards direction, side, and down into your pelvic floor. All of this helps you to control that intra-abdominal pressure more. Make sure that it's evenly distributed throughout your back, your sides, and down versus all of it pressing forward and down and causing you to lose control of that pelvic floor. When you do this, the back breathing, you should feel like your back is expanding as you take your breaths in. And then when you breathe out, try to maintain that expansion. Try not to let it go. See if you can maintain it and then make it bigger and bigger and bigger every time you take a breath in. So you feel that full stretching of your back, you get full mobility of your spine. And when you are doing activities like sneezing, jumping, laughing, I know that it's not always easy to think about it in the moment. You're not going to be thinking, oh yeah, let me brace my core, let me back breathe as I'm about to do this. But the more that you practice this at home, the more natural this will become for you, and you will naturally brace in this way, move in this way without even thinking about it. As I said, I've been on my own pelvic floor journey since having my 2 kids. And one thing that I noticed is when I was jumping with my sons on the trampoline at a friend's house the other day, as a physical therapist, often tune into my body, think about what am I feeling right now? What muscles am I using right now? How could I, use this information that I'm collecting from my own body to give to my patients in the future? And as I was doing kind of a whole body self-assessment, I noticed I'm naturally contracting my transverse abdominis and I'm not even thinking about it. So that's what we're trying to go to. We're trying to reach that goal of natural engagement of these muscles without you even having to think about it. But you won't get there unless you practice. So our third exercise that we're going to do for our pelvic floor is going to be bridges. Now I know we've all seen bridges. Again, same as pelvic tilt. We've probably done them in our yoga classes, Pilates classes. We've done them in a gym class. And there's going to be different types of bridges out there. But when I'm talking about a pelvic floor bridge, I am talking about using a pelvic tilt to start you out, using your glutes and keeping your knees in line with your hips as you bridge, and then specifically making sure that you do not arch your back at all as you lift up higher, okay? Like we said, we want to be able to control our intra-abdominal pressure and have good space in our abdomen versus contorting ourselves as we're doing bridges or standing, walking, sneezing, and then that leads to us losing control of our pelvic floor. So as you bridge, like I said, you're going to start out in the same position as a pelvic tilt, with your knees bent, feet flat on your back. You're going to make sure those knees are in line with your hips, and you're going to start that tilt, that pelvic tilt. But with the bridge, you are allowed to squeeze your bottom. You are allowed to push through your feet this time. So you're going to roll up one vertebrae at a time and roll down one vertebrae at a time, okay? Vertebrae being each bone that you feel in your spine sticking out the back of your spine. You want to imagine peeling one bone up at a time and then placing them down one bone at a time, versus we do not want to just lift up, go back down. okay? That's gonna lead to more overuse of our lumbar extensors rather than our core muscles, which will help us to control that intra-abdominal pressure better. The fourth exercise that we're gonna talk about is adduction. So I mentioned earlier that your adductors are part of your pelvic floor. Most people don't think of it that way since they do stretch all the way down to your knees, but they do attach up at your pubic bone. And so they are going to have an effect on your pelvic floor. They're going to change where your pelvis sits as you're standing, walking around, jumping on that trampoline. So we want to make sure that our adductors are strong and ready to help us maintain that core contraction, maintain that intra-abdominal pressure how we want it to be. So this exercise we're going to go over is a side lying adductor exercise. To do this exercise, you're going to be laying on your side and you're going to use something like a foam roller or a pillow to place underneath your top leg. As you're laying on your side, that top leg is going to be at 90 degrees of hip flexion and 90 degrees of knee bending, resting on top of that foam roller, all right? It's your lower leg that's doing the work in this exercise. So from the start position, you're going to lift your lower leg up towards the ceiling. There's lots of compensations we're going to watch out for though, because that sounds too easy, right? So what you're going to watch out for is you are not going to let yourself lift your leg up and forward, okay? It has to go straight up and down. You're also not going to let yourself rotate your leg too much unless instructed by your physical therapist. And you're not going to let yourself bend your knee in order to cheat with your hamstrings. That knee needs to stay locked out straight. Lastly, you're not going to let yourself side bend in your spine to help you lift your lower leg higher. All right. You need to maintain, again, good core control with a long back by doing a pelvic tilt in this position. You can use your back breathing as you're doing your leg lift to maintain that good intra-abdominal pressure and practice engaging your adductors while also having good intra-abdominal pressure. What's the point of practicing in a bad posture or bad position, right? The last exercise that we're going to do for your pelvic floor is going to be an exercise to stretch out your glutes. So oftentimes when we have issues with peeing ourselves because we're jumping or we're sneezing or we're laughing, that has more to do with the lack of intra-abdominal pressure control. However, if you have tight glutes, that can cause you to shove your femurs forward in the socket, cause you to stand differently, and then change the intra-abdominal pressure and your posture. So we're gonna work on stretching those glutes to make sure they are not contributing to making you lose your good posture. So the exercise we're going to do is going to be a glute internal rotation stretch. There's several positions you can try it in, especially if this one doesn't work for you, but we're gonna try it today laying on your back. So laying on your back, legs out in front of you, you're going to bring your leg that you're gonna stretch, your glute that you're gonna stretch, you're gonna bring that leg up towards your chest, grab behind your knee, so that way you don't have to bend your knee more, and if you're suffering from irritated knees, it'll just feel better if you grab behind your knee, okay? Grabbing behind that knee, bringing it up towards your chest, but then also over towards your opposite shoulder, okay? You should feel the stretch in your glute. If you are not feeling the stretch in your glute, if you're feeling it more in your groin of that leg, which I have seen people feel, that is very much a sign that your glutes are super tight and shoving that femur forward like I talked about. So to counterbalance that, you are going to do your pelvic tilt, your best friend, your pelvic tilt, to go ahead and create more space, more hollowed out space for that femur to drop and not be shoved so far forward because of your glutes, okay? So holding that glute stretch for 30 to 90 seconds. If you are not holding for at least 30 seconds, they've shown in research you are making no long-term changes. And if I could get one thing through to a lot of people, it would be you need to hold your stretches for at least 30 seconds, okay? And when I say 30 seconds, I mean 1 Mississippi, 2 Mississippi, 3 Mississippi, not 1, 2, 3, 4, 5, 6. You're only hurting yourself if you're not holding it long enough. So holding this glute stretch, doing that 30 to 90 seconds will help to release that. Now you've got more ability to keep those femurs back, stand with a better pelvic tilt, stand with better back breathing. We're nice and stacked, and we have no intra-abdominal pressures when we need to sneeze, laugh, or jump on a trampoline. If you try these exercises and you're not noticing improvement in your symptoms, please reach out to your local neuromuscular expert, which would be a physical therapist. Oftentimes, they want to make sure that you're doing the exercises exactly how you should be doing them because, like I said, these are very easy to do a little bit incorrectly, and you're not going to get the full benefit if you're doing them incorrectly. So a physical therapist can make sure that you're doing them exactly how you're supposed to be doing them, and also can do hands-on treatment if the stretches are not enough and you need to get some hands-on treatment. Specifically, look for a physical therapist that does specialize in pelvic floor issues, so that way they can help you even more since they specialize in that. Like I said, I'm Dr. Christina. I love to educate on topics and share free information so you can understand more about your body, be more independent in your life. So if you found this video helpful, let me know. If you like this video, if you found it educational and you'd like to share it with friends or spread the message, please make sure to like, follow, and subscribe, and I'll continue to share more educational videos like this.